We are starting to see colleagues from different sectors working together in a way that just didn't ever happen in the past, and I really strongly welcome that. I also very strongly welcome Harold's comments about the sense in which the answers to the massive challenges we face, to a very large extent, rest with the people in this room, the people in Norfolk, the leaders in Norfolk, to make change happen. And I think one of the really exciting things at the moment is that around the country there is some real dynamism, real leadership, great things happening, not because Whitehall has told people to do things, but because people have taken control and have determined to change things for the better in their communities. And we've got some great leaders actually here in Norfolk to make that change happen. We've got excellent clinical commissioning group chief executives. We've mentioned Jonathan. I see Mark from my own clinical commissioning group in North Norfolk. But we have a brilliant leadership of the care sector. Dennis and his colleagues do fantastic work, challenging but also engaging with the statutory sector. And it's great also to see Martin here showing brilliant leadership nationally, and my old friend and former combatant David Pryor. For 6 years we were head to head fighting it out for the same job in North Norfolk. Thankfully I finally prevailed, but I like to think that I freed him up. I freed him up to do the job that he's doing now. And indeed, I nominated him to do this job. And I think it says something that two politicians who were at each other's throats for 6 years had indeed, at the end of it all, a degree of mutual respect. And I felt that he was absolutely the right man to chair the Care Quality Commission. Can I also thank all of you for the work you do. There is some brilliant care provided in our county. People working often under very tough circumstances, extraordinarily tough financial circumstances, but the work you do is critical. We were at, all the MPs in Norfolk were at a Chamber of Commerce conference recently, and we were all asked to identify the sector of the economy in Norfolk which we thought was most significant and most important to our county, and I named the care sector, because it's often thought of simply as a burden on the economy. But this is such an important sector to our Norfolk economy. Just think of the number of people employed in this sector, the number of businesses, the extent to which it supports our local economy. It's so important. So thank you for the work that you do. And I think it's in all of our collective interests, and we all have a role to play in achieving and striving for the best possible standards. Government has a clear role. It has a role in terms of the funding that it sets, in terms of the regulatory framework it sets, and we heard from Harold about the Care Act a few moments ago. The local authority plays a critical role locally, the regulator, the Care Quality Commission, and then the providers, and indeed the workforce. And I'll come back to the workforce a little later. Now, I wanted just to say a word about the challenge we face. It is enormous. First of all, in terms of the financial position, we faced in 2010 a deficit. This means we were spending as a government about £160 billion a year more than we were bringing in taxes. 160 billion. Now, we've got that down to about 100 billion, but we are still, as a country, spending about 100 billion a year more than we're bringing in taxes. That's the scale of the challenge that we face. And yet we also have a system, a health and care system, that is under enormous pressure. Just think of dementia alone. We've got great leadership from Willie Cruikshank in our county, leading the Norfolk and Suffolk Dementia Alliance. But dementia alone could bankrupt our health and care system unless we find solutions, unless we find better ways of providing care and support for people. And the next 5 years, it seems to me, is crunch time for the NHS and for the care system. Given the financial pressures, given the state of public finances, given the challenges that are growing ever greater, 1.9 million people with 3 or more conditions, long-term chronic conditions in 2008, growing to 2.9 million by 2019, an increase of over 50% on a system that's already under strain. So we all can see that something very significant has to change. And for me, the next 5 years, whoever is in power, is make or break for the NHS and for the care system. And there is a collective need, a collective imperative for us to work together to find solutions. So key elements of the way forward. First of all, we have to strive for a strong economy. It is essential. You cannot deliver great public services from a bankrupt government. So a constant focus on getting our public finances sorted out, getting the economy growing, is the best way of preserving our NHS and our care system. But we need, in my view and in my party's view, extra investment in the system. We are arguing the case for the autumn statement, which comes at the beginning of December, for extra resources for the system. It is necessary. If you look at the indicators at present, they are going in a worrying direction. The system is under intense pressure. We need extra resources. But we also critically need to change the way we do things. And I just wanted to focus on that in the time that I have available to me. First of all, we must surely, and I suspect you probably all agree with this, we must end the culture of top-down reorganisation of our health and care system. It just does not work. We have tested this to destruction. Repeated governments have tried it. And if you think about the psychology of it, if you force change from Whitehall, people will reluctantly go along with it, but will they go along with it with any passion and desire and determination to do the very best they can? On the other hand, if you empower people at a local level, whether it's clinicians, whether it's business leaders, whether it's local authorities, to do the very best they can, to reshape services in the way that they know will work best for people, then you can achieve some great things. That's at the heart of my Pioneer programme, where we have 14 integrated care pioneers around the country showing how you can do things differently. Brilliant local leadership demonstrating that you can achieve great savings. I was at Greenwich last week, one of the integrated care pioneers, where a brilliant collaboration between the local authority, the NHS, private care providers and the voluntary sector has resulted in the lowest level of emergency admissions across London. They are saving money, but they are making a massive difference to people's lives. It's nothing that Whitehall has imposed on them. They are doing it. And that's why Harold is absolutely right, that we have the power and the means within this county to change things for the better for the people of Norfolk. So no more top-down reorganisation. But we have critically, in my view, to think about the health and care system. Let's just move away from this awful us and them, health versus care, private versus public. This is a cul-de-sac. It achieves nothing. It has to be based on partnership, on collaboration. And we will only succeed by shared endeavour regarding all of the participants in the system as partners. Next, we have to fundamentally shift the focus to prevention and preventing a deterioration of health. Bless you. Dennis talked about the amount of money that is wasted within the NHS. As I walked into the room, I think he was referring to £5 billion spent on agency staff or something quite horrific like that. But the way the system works, the way the incentives in the system work, we incentivise activity in acute hospitals. We call it payment by results, but it is payment for activity. So over the last 4 or 5 years, the income of acute hospitals has continued to grow. Admissions has continued to grow. Does the hospital have any incentive to keep people out of hospital, to keep people in better health? No, it doesn't. There has to be a fundamental reshaping of the incentives within the system so that the whole health and care system are focused on preventing a deterioration of health. And that, indeed, is where all of you come in, because your part of the system is fundamentally focused on keeping people in better health, keeping people out of hospital. So I totally agree with what Harold says. We have to pool the whole health and care budget, not imposed from the centre, but just a requirement that by, say, 2018, in our county of Norfolk, we should work on the basis of one pooled budget for the whole of the system, with incentives aligned so that everyone within the health and care system is focused on keeping people out of hospital and in better health. And in that way, we might just make better use of the resources that are available to us. We have to fundamentally join up care. It makes no sense to the patient that we have institutionally separated mental health from physical health, primary care from secondary care, and health care from social care. This has to change. We also have to change from a system that is fundamentally still pretty paternalistic to one that is acutely personal. Actually, in local government, there's been much more innovation. Harold talked about the move towards personal budgets. There needs to be much more of that in the NHS. And the Care Act is fundamentally about an individual's well-being. At the heart of the Act is the concept that every decision that is taken has to be focused on the individual, the person's well-being. How can we give that person a better life, rather than thinking about systems and thinking about the delivery of services? And this modernisation, in my view, is very long overdue. It also introduces, from 2016, some fairly significant changes to introduce the cap on care costs for the first time ever, and extending means-tested support so that more people on modest means will get a contribution towards their care costs. And introduced from next April will be the idea that if you are on the point of losing your home just to pay for your care costs, you will be entitled to a low-cost loan from your local authority to prevent you having to sell at a moment of distress, so that you can do that at a moment when you decide, rather than it being forced on you. And there is massive new support for carers, a group that have for too long been neglected. I should also just say a word about commissioning. There's a big focus, of course, on standards that providers offer to their residents and to their service users. And David Pryor at the Care Quality Commission has a big focus on that. And as I said at the start, we all have an interest in raising standards to the highest possible level. But there is a role for the local authority as well, and the spotlight has to be on the quality of commissioning by the local authority as well. We have to surely move away from commissioning domiciliary care, for example, just on the basis of paying for time. We have to move to paying for outcomes for people, and I know that Norfolk County Council is on that journey. But the Care Quality Commission has powers, and we have the powers to ask the Care Quality Commission to investigate failures of commissioning. And I am determined that where that happens, where there is evidence that that is happening, we will use those powers because the spotlight has to be on both commissioning and on providing. Let me just end by talking about the workforce. I was really privileged to give one of the awards at the first ever awards evening in Norfolk to celebrate brilliant care in our county. And it was just the most remarkable occasion. I don't know how many of you here were present that evening, but to see people who had never ever in the past been recognised going up on the stage to receive awards for offering brilliant care to often very vulnerable people was really inspiring. And I think it's just so important, as we seek to elevate the whole status of this vital sector, that we recognise excellence and celebrate excellence. Too often the focus is only on the failures of care, not on the brilliant care that is so often provided across our communities. And we need to do much more of that. We are, at a national level, introducing the care certificate. That comes into force from next year. The idea of that is that there should be a national standard for care, for basic minimum training standards and competence standards across the system. And it appears to have been very well received by the sector. And I think that it's long overdue, so that everyone knows, that has confidence that when a loved one goes into a care home or receives care at home, that the individual providing that care will have received that minimum level of training. And I know that for the vast majority of people, that training is already in place. But let's just reassure that there is a standard there that everyone has to meet. But I think it's also important that for care workers going into that profession, thinking about applying for the first time to become a care worker, that there is some sense of a career progression ahead of them, that there is an opportunity for those who want to go on to become nurses. I know there's an enormous shortage of nurses within the care sector, but why don't we let those brilliant care workers who do such fantastic work to see the potential to go on professionally, to go to the next stage? Is there perhaps the need for an intermediate level between the care worker, the care certificate, and the fully qualified graduate-trained nurse? I think there's a very good case for something in between, which could be of massive use to the care sector and give a real sense of a career ahead of people as they think about joining care as a profession. So let me just end by restating in a way the thing that perhaps drives me more than anything else in this job. Harold mentioned it. I had to do a speech last week to a local authority conference in Manchester. I'm absolutely driven by the need to achieve equality for mental health. For too long, it has been the Cinderella of the system. All of the incentives focus on physical health, not mental health. If you have suspected cancer, you are entitled to an appointment with a consultant within a fortnight of referral from your GP. If you have a first episode of psychosis as a teenager, you have no such right. You may be lucky and get a good service. You may be lucky and have a fantastic service in your community, but all too often there's nothing at all. You may be waiting months on end for any proper support. That, to me, is intolerable. It's a discrimination at the heart of the NHS. There are all sorts of access and waiting time standards for people suffering from physical health problems. There is nothing in mental health, and it absolutely drives where the money goes. That has to change. So I was incredibly proud in October that we were able to announce the first ever access and waiting time standards in mental health, a 2-week standard for early intervention in psychosis for all those youngsters who are too often let down by the system, and a 6-week standard for people waiting for psychological therapies if they're suffering from depression or anxiety. And at the same time, we published a vision for comprehensive access and waiting time standards across mental health introduced over the next 5 years. I'm on a mission on this. I think the time that mental health is disadvantaged in this way must be over. The moral case and the economic case is overwhelming for equality. We know that if you invest in evidence-based interventions in mental health, you get a return on your investment in hard economic terms. But overall, and most important of all, you can make a massive difference to people's lives. And that ultimately is surely what we're all about. So I will continue this fight for as long as I have this job, probably not too much longer. But I never expected to have it in the first place, so I will do everything I can while I have the chance. Thank you very much indeed.